My name is Dr. B, and I am a pediatric neuropsychologist.
And I'm Catherine Mukes. I'm a licensed professional counselor. And welcome to Let's Talk.
Today we are going to be talking about how to know when it's time to seek help from a mental health provider, whether that's help for yourself or seeking help for someone else like a family member or your child, or whether that's encouraging a friend to seek help from a mental health provider.
Right. So many times we see things that are happening and we get afraid or nervous. We don't know what to do about those situations, and so sometimes we just kind of ignore them, hoping that they'll go away, and we sweep them under the rug. So today we just want to make sure we give you some tips, some things to look out for that may be helpful in knowing when it may be time for you, for yourself, or for someone that you know or care about to seek professional treatment.
Now, we want to say that there are certainly daily stressors that we experience that will change our mood at times.
Absolutely.
That will change our behaviors at times. And those types of situations are perfectly normal and expected.
Absolutely.
And dealing with daily stressors in life, I mean, they will come, that will happen. But there also is a point at which these behaviors, changes in behaviors or changes in emotional function warrant additional help from a medical professional or a mental health provider. One thing that comes to mind for me is seeing changes in a person's appetite. For example, a person is eating a lot more than they typically do, or they are eating a lot less than they typically do, and that this is not just happening over 1 or 2 days. For example, if I'm feeling pretty down one day, I may not eat as much. If I've had a situation happen at work, then or in my family, I may not feel like eating that day. But should this persist for an amount of time where there's a notable change in my weight, where I've gained a lot of weight, or where I've lost a lot of weight, it may warrant some further attention.
Absolutely. And appetite is a great one, because a lot of times it will show up in our weight and those different types of things. And so other people may start to notice, well, hey, you look like you've lost a lot of weight, or you notice that your pants are not fitting as much, whether they be too big or too small at that point, and it wasn't intentional weight loss. And so let's be clear, just because someone's lost weight or gained weight doesn't necessarily mean that there's an issue there. But if it's unintentional, so you've dropped 20 pounds not because you've been going to the gym or walking or anything like that, and you've lost 20 pounds in a week, then there may be some things that are going on that we want to pay attention to and seek some help, whether it be medical attention and definitely the possibility of mental health attention.
Yes. And I would agree with that. And to add to that, while we talk about some of the things that a person or behaviors a person may exhibit, or lack of behaviors, many of these behaviors occur in constellation with other behaviors. So they're not just kind of, you have
standalone.
Right. You change your appetite has changed, or your weight has changed. There are some other things that go along with it. And another behavior that you may want to definitely kind of keep an eye out on is sleep behaviors.
Absolutely. Yeah, because we know how important sleep is to us overall. But if you normally are someone who gets your normal anywhere from 6 to 8 hours of sleep a night, and now you're finding it takes you 2 hours to fall asleep, or it's taking you you're having trouble staying asleep, you're finding yourself frequently waking up, and not for biological reasons, but just you're waking up and now you're having a difficult time getting to sleep, and your sleep is diminishing, and that lack of sleep is also impacting your functioning, then it may be time to talk to somebody about what's going on, to maybe figure out what those things are that's happening, and to help get you to a place to where you can restore that sleep process and your functioning with that.
Exactly. And sometimes what goes along with a person, particularly one who may have increased need for sleep, is that they can appear to be more withdrawn, staying in their room more, avoiding social interactions, even with loved ones, not kind of just wanting to remain in their own space.
Right. And so definitely the same way with appetite, sleep can be too much or it can be too little, and it's also impacting your functioning. One of the things that we've discussed a little bit is about how that may, some symptoms that may look a little bit differently in children. And one of the things that you particularly pointed out was about the irritability.
Certainly. You know, the way that things present in children and adults can differ sometimes, and irritability in children is a strong indicator. And granted, this means they're going to have some irritable days. We all do. But irritability that is, you know, nearly every day and it's pretty consistent is definitely a cause for concern, particularly when it's a change in behavior from their kind of normal mood. And irritability can signal a number of different mental health concerns and certainly warrants more attention.
Absolutely. And I'm glad that you mentioned about the normal behavior, because what happens sometimes is we see things either within ourselves or people that we know and care about, that we don't know for sure if that's really normal behavior for them, because we try to set the normal behavior standards across the board and they don't always look the same. And so, for example, if Johnny is just kind of a little grumpy little boy, then, you know, if he's irritable this week, well, that might be status quo for Johnny if he's always had that temperament. But if Johnny was typically a happy-go-lucky child and that now all of a sudden he's getting into fights or he's talking back or he's breaking things or doing things that are just not normally his presentation of behavior, then you definitely want to keep an eye out on those things.
Certainly. And the other thing that we want to emphasize is that we are thinking about these symptoms as they occur over a period of time. Right. So just really emphasizing that it's impacting daily functioning, whether that's in school, whether that's at work, whether it's in relationships, you know, extracurricular activities, social functioning. It has to impact those areas, one area or more than one areas, and it needs to be noted over a period of time. We definitely don't want to sound the alarms for, you know, one day where you don't get enough sleep or you know, have slept quite a bit.
So Johnny brings home that one bad grade. Mom, don't rush him down to the local therapist office.
Exactly. So just to recap on some of the things that we've talked about today, these are only some tips. This is not, you know, exclusive. There are many other things to consider, but just some of the things that you may want to pay close attention to if you have concern for yourself or for your loved ones are changes in appetite,
changes in sleep patterns,
withdrawal behavior, so kind of staying, you know, to themselves, restricting themselves from social interactions with loved ones.
In young children, their levels of irritability, especially if it's a change from their normal presentation.
And observation of these behavioral and emotional concerns over a period of time that impact the daily functioning.
Absolutely. So we hope that these tips have been helpful to you. If you have questions or concerns about these symptoms or these tips or any others that may be out there, feel free to drop us a note or a line in the comments section.
Remember to like, share, and leave us a comment.
And we look forward to seeing you next time for Let's Talk.